This is Dr. Justina Agnieszka Chevalier. Just as I planned in the last chapter of my book, which is an addendum, I will now present an offer that consists of an actual already taken based on kidnappings to perform labor on behalf of persons that were actually in need of that information and in need of my capacity in diverse countries, as well as in situations where persons were in pain and in need of life-saving maneuvers. As human rights activist, and then by learning about the proper approach to medicine and epidemiology, I came up with what is only like an adjustment to a crooked mirror, an understanding of already learned by you material in specific area of your expertise and adjustment to your skills that I will now first present in what is called good an outlook on medicine. In medicine, if we take material that I've intimately learned and studied while performing already as a independent researcher and consultant at the University of Texas, Houston, I actually also learned a lot about a, a relationship described before in a given area between what is in active state of suffering, sending message to be saved in the form of mimicking same harm to a person that is then presented as mental health disease and results in such approach that are done by humans to humans and is reflected in distortion of medical arts. Those distortions are presented, for example, I will just take, because this chapter is about forensics and criminal psychology and psychiatry as well. I will present it in a general epidemiology formulas that consist of number needed to treat, consist of an actual assumption that there is a need for creation of death and harm to perform an action, and that is unethical and goes against do no harm oath of medicine and also the actual state of art of medicine. And proper formula is a formula number of persons in harm needed to commensate, to perceive in self manifestations of such state as one that is direct responsible of humans as species in self, in form of distress, anger, sadness, and then the remediation for it are not psychotropic drugs but an actual right away action. Psychotropic drugs are offered often in or asked for in ignorance to such happening and lead to death. And that, to understand, always we need to include all of living beings and understand, for instance, that number needed to intend to perform life-saving action depends on value and understanding of the knowledge presented here, in such that this is not something helpless but caused by humans that you, whoever you are you are part of as a cohort, and all of what is done to animals leading to harm and death from microorganism to other organisms, and then distortion of such in holistic so-called approaches that then delay actual epidemiologic maneuvers to enable distribution of goods and pursuit of goods in no harm but thriving, including all that is possible and an utmost goal of human intellect. And that is what needs to be taken based on that, for example of a formula, into consideration rewriting medical books for preparation. And when you learn every single science, you need to understand also in medicine that cellular changes are subject to non-regeneration in proportion of a need for weakening of a human caused by non-action of other humans and human in a saving from being directly inflicted injuries to kill or directly inflicted injuries to deprive body parts or mutilate, and also directly inflicted injuries to fertilize and deprive the indirectly inflicted injuries of pregnancy, milk and pregnancy products that then results in a prison, for example, that is an exact replica of a chicken coop affiliated with a killing plant, and that is also a direct replica of a dog shelter where animals from streets are trapped, sedated with barbiturates just like humans because of being free, and then because also of pursuit of wanted relationship, deprived of fertility or life in a purposeful or gradual way. And that is not something that will not long term or short term kill you. And if you ever derived such sense or such perception that it would, and that the death is predetermined in statistical formulas, you are wrong in assumption of own incapacity and in assumption of a complete non-controllable state of the universe that is called Earth, in which in conscious effort we kill in fact the largest amount intentionally of all living beings and destroy the largest amount of things in pursuit, in disregard of life, of selective survival, marking them in formulas calculated based on that chances for survival as facts to aspire to pursue an income in hopes of remediation of diseases by implementation of whatever it is that is destroyed at expense of harm and death of other species or same species to body parts and self, and that then ends in immunosuppressants, and then also ends in survival that is limited in movement and by payment and also by pain, and that is remediable and enables generation immediately if you actually understand that it is not state of art of medicine and nor other sciences, and we are part as humans of the ecosystem responsible for such formulas and such negative and pejorative search to, in first instance, which is really scary, create disease, and in second instance remediate that disease with as invasive as possible methods in creation of a perception that others are unable to understand and promotion of their ignorance, and then invasive pursuit of incapacity as derived from surgical procedures and also radiation as well as chronic medication instead of actual knowledge and awareness of the universe that is important to science and sole source of a proper adjustment of that knowledge. Another example of a good outlook of medicine: assume first that everything in a sudden or chronic pain is experiencing a progressive death of self, and that is always as a result of non-action while being directly responsible and not aware of, or indirectly responsible and not being able to take action or indirectly responsible and not being able to understand when and how the necessity of that action is in the real immediate moment needed, which is ignorance and lack of knowledge, and such is then need for education, and you cannot discard such as mind material and lack of knowledge when it costs not only yours but other persons life and time spent in pain, and such then in accusation towards person like I who work because of such high demand of ignorance, and also in ignorance to the existence of pain, that I cannot in fact ignore often demand for work, being kidnapped and harmed and harassed severely to work, while others actually impede that work dying, and that results from non to me conforming and expectation of satisfaction from having all of my friends and loved things dying, and you are one of them, and you need to understand that, and so is everything that you love around, and that is the attitude in medicine. First pursue, when you are a medical practitioner such as I am doing these lectures, when you pursue knowledge about well-being of a person, first establish the degree of discomfort by asking a direct, explicit question. Are you in active pain right now? And do not threaten with causing harm, trapping, or drugs if the answer is no, sir, madam, I am not in an active state of pain right now. The second is if the answer is opposite, and person screams, as I witnessed in jail of Bismarck, North Dakota, I fell, and I quote, on my back and it could be soured, help. And you pursue sexual adoration or implication of superiority and entitlement to take corrective action as ignorance, being a nurse, because I witnessed that from a nurse, of such demand for assistance, you are subject to criminal investigation from my initiative and initiative of international organization, and it is a fact for that institution, in disregard to the sudden need and acute need right now to take action to improve now, that I do not, despite providing chance for information, see that. And you need to understand that apart from what seems like a threat from a legal system, what really is in fact concerning is what it will do to you when you lack this knowledge and that awareness or such capacity, if you don't do what I'm trying to propose to you and apply for self and to offer to others, that it will result in your demise and the demise of your loved ones, and in suffering, which is sometimes worse than demise, in sense of superiority, in incapacity or in shame to ask for such. Do not be ashamed of asking for help, because know that whoever or whatever is at your mercy right now or depends on you generates such, and that is unwarranted, and you can always ask me for help and advice, and be it with or without monetary compensation in pain. And such should be true for all of medical practitioners, and in timely manner, and assume that threatened we all do take action against actually being threatened as a source of personal resentment that in many times leads to passive aggressive incapacity to give assistance because of the degree of caused directly inflicted injuries also on me by medical professionals because of incapacity to attend or communicate with patients or inmates. That is not an explanation and creates a potent resentment, while action, official one that could change everything quickly, is not being taken. that is not over.